today's video, I'm going to be inserting a nasogastric tube. So first I'm going to go into the patient's room and I'm going to go ahead and adjust the patient's bed. So I'm going to put him in a semi-phallus position. Once that's done, I would go ahead and introduce myself to the patient. So hello, my name is Tajira Lockin and I'll be your nurse today. I'm going to go ahead and make sure to get his name and date of birth. So can I please have your name and date of birth? Once he have given that to me, I would go ahead to check his wrist to make sure everything is good, and everything is good so I could go ahead and provide privacy for the patient. Once privacy is provided, I'm also going to make sure that I also tell the patient what I'm going to be doing. So I'm going to let him know that I'm going to be inserting a nasogastric tube and it's supposed to help with suctioning of anything that may be in the stomach that needs to be removed. So first I'm going to go ahead and make sure that nothing is in the nose, and I'm going to check to see which one I'm going to be going into. So I got to see which nostril has the most airflow, and then I'm going to choose. Once that is done, I'd go ahead and provide hand hygiene, and then I'm going to go ahead and put my gloves on. Once my gloves is on, I'm going to make sure to measure to see how far I'm going to be going into my patient's nostrils. So I'm going to measure from, I'm going to go ahead and measure from the nose to the earlobe, and then from there I'm going to go ahead and measure to the patient's xiphoid. So once I got that, I'm going to make sure to put tape so I won't lose the measurement. So I got my tape on. I'm going to put this to the side a little. And then I'm going to prepare my tape that I'm going to be using on the patient's nose. I'm going to use another tape. So I'm basically making a little split so it would fit well on the patient's nose. So once that's done, I'm going to put this on the side until I'm ready to use it. So now I'm going to go ahead and put a towel over the patient. It's going to be right here. And then I have everything. I have my marking on my tapes. I know how far I'm inserting. I'm going to make sure to lubricate it, and it makes it easier to go in. So I'm going to lubricate maybe like 4 inches. Once that's lubricated, I'm going to go ahead and tell the patient to like tilt his head back a little. I'm going to go ahead and insert. I'm making sure that it actually pointed downwards. Then I'm inserting. Once it's in a little, I'm going to go ahead and make sure to lift the patient's head up a little so I make sure that it goes all the way back. Okay. And then now I've got into my tapes. I know that it's in right. So once it's in, I'm going to go ahead and get my tape. I'm going to put it on the bridge of the nose right here. And then I'm going to tape it under. Okay, once that's on, now I got to check to make sure that the tube is in right. So first I'm going to go ahead and tell the patient to open his mouth so I could see if there's anything called up behind. And I noticed that everything is good. Then I'm gonna go ahead and aspirate. So I'm aspirating, so I'm going to go ahead and aspirate maybe like around 10-20. So once that's out, I'm going to go ahead and take my pH paper and then I'm going to put whatever was aspirated on the paper, and then I'm going to compare it to see the color. And I want to get something acidic because we all know that the stomach is very acidic, so I'm trying to look for a number that matches, like maybe below 3, below 4. So once that's done, I would know that it's actually in the stomach, and then it's in. So now I could go ahead and while doing so, I could have also went ahead to, because my tube went in so easily, but it's not always going to be like that, so I could always go ahead and let the patient drink a little water, and that would help it to go down easily, and make sure that he breathes properly so everything could be good. So once that's done, okay. Another thing that we could have done to make sure that it's inside the stomach was to put air in. I'm going to go ahead and put it on. While putting the air in, I got to make sure to listen. So while I'm listening, I'm putting the air in and I'm listening for a whooshing sound. So once I can hear that, I know that it's actually in properly. So once everything is done, I'm going to go ahead to remove, I'm going to take another piece of tape because I want to make sure that everything is supported. I'm going to do the same thing as in the first one when I tore it in half a little, not all the way off. And then I'm going to go ahead and put it on here. I'm going to take the old one off. Make sure that I'm not pulling back out the tube. So once it's off, I'm going to go ahead and make sure to clean on the bridge of the patient's nose to make sure it's not too oily, because if it's too oily, it probably won't stick. So I'm cleaning on the patient's nose. Once that's done, I'm going to go ahead and put the tape on. I'm putting it on the bridge. Then I'm going to do the first one. I'm putting it under and then around and then back on the bridge of the patient's nose. And then for the other one, I'm doing the same thing, under and then on the bridge of the patient's nose. So now it's supported. Now that I have this all secured, I'm going to go ahead to put another piece of tape on the tube, and then I'm going to attach this to the patient's gown. By doing so, I'm going to go ahead and use a pin and then pin it onto the patient's gown. And then that's to keep it secure. So once that everything is done, we know that everything is good. So I'm going to go ahead and remove the NG tube. Removing the NG tube, it goes through the same process. I'm going to introduce myself and everything. So once that's done, I'm going to make sure, before removing it, I got to make sure that the reason it was put in, that everything was resolved. There was nothing going on. Everything was removed. So I'm going to go ahead now and make sure to first unpin this. Then I could go ahead and put this down. And insert my syringe. And I'm actually putting air in. And this is to make sure that there's nothing inside the tube when I'm removing it to take anything out. Then once that's done, I'm going to go ahead and slowly take the tape off. Try not to cause any damage to the patient's skin. And then I'm going to slowly remove the tube. And then I could go ahead and throw this out. And that will be it for removing the tube. But I'm also going to make sure to take everything out, put the patient back down and put him back down into a comfortable position. And then the last thing I would do is to make sure to document all the information that was done. And then that would be the end of my